Welcome to the Heart of Innovation, 60 minutes that could save life and limb, with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by patient advocacy group thewaytomyheart.org in partnership with Abbott. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of The Way to My Heart, Kim McNicholas, and interventional cardiologist and founder of the Save My Piggies Health Education Series, Dr. John Phillips.
Hi, everyone, and welcome to the show. I have a really grim statistic for you. I know Dr. John Phillips is going to love this one. Every 20 seconds, somewhere in the world, someone is getting a limb amputated due to a diabetic wound that will not heal on their feet. It, in a large part, is due to lack of blood flow. But also the other half of it is lack of proper wound care. And so today we are going to be focusing on cutting edge technologies that are advancing wound care for specialists around the world, putting them in the hands of clinicians everywhere. It's all in an app called Wound Care Pro, and it is by a clinician, Ann Walsh, who is going to be joining us today. So we're really excited to have her. The wife of one of our patients had posted about this on LinkedIn, John. And I was like, whoa, I'm hijacking this conversation. And
Not you.
Our friend, I know, right? Victoria ended up introducing me to Ann Walsh. I love social media. You know me. Love social media. This is the perfect instance where it is so beneficial making those connections. So yes, and Victoria is even going to join us to share why she is a big fan. She's also a nurse herself, and she is going to share why she's such a big fan of this technology and why she shared it on LinkedIn. And then we're going to also be joined, of course, by Ann Walsh, the founder of this app.
That's fantastic, and it really dovetails into several conversations I've had this week regarding wound care or lack thereof for our patients. I am a proponent of, and I've said this in the past, the role that I play as an interventionalist. I am a plumber. I don't do wound care. I don't know of too many, if any, interventionalists do wound care. I know some vascular surgeons do it, but at the end of the day, at least in my opinion, the quarterback of that patient, meaning who's driving the treatment plan for that wound, is someone in wound care, typically a podiatrist or maybe a ortho foot and ankle specialist. But we are actually taking at Ohio Health, doing a deep dive into our amputation rate, which is no higher than that of the region or the country. And it depending on like how you run the numbers. We had, I think, 27 major amputations. We talk major amputation, we're talking above the ankle over the last several years. That's 27 too many, in my opinion, but sometimes the quote horse is out of the barn. And one of the cases that we reviewed this past week was a woman who had all the risk factors for peripheral arterial disease, which we spoke of: diabetic, high blood pressure, dyslipidemia, things of that nature. And she, in October of whatever year it was, got like her dog scratched her or something. And we hear this and see this
all the time.
It took until December for her to have the end of December. Frankly, I think it was January 1 when the result was provided, not even to us, but where she had non-invasive testings to assess arterial flow. And by that time, the wound had progressed. Ultimately, my team was able to kind of expedite and get her seen by vascular specialists and this, that, and the other, but it's too late. My point is, it took over 2.5 months for someone to put the dots together. Like, this wound isn't healing. If they would have evaluated her vascular supply, they would have known it was abnormal. They would have got the testing. We potentially could have saved a leg. No. She ultimately developed, so she lost her right leg. She ultimately developed critical limb ischemia on the left.
Oh, no.
That, because of what happened on the right, everybody was a little more aware. She was referred to me. We were able to revascularize and save that leg. But again, this conversation, we have it all the time. Yes, we're great plumbers, we're great interventionalists, but we're not. How are we getting these people appropriate wound care? How do we raise their awareness for their wound to get them to somebody that can help them? So I'm looking forward to talking to Ann, hearing about the app, learning, and maybe using AI to like take those human errors out of it to help preserve limbs and lives and save the piggies.
Oh, I mean, I deal with this every day, and I just had a doctor over in Michigan that he had revascularized a woman's all clear down to the pedal loop, and was on track for healing, and it was improper wound care that ended up leading to it just becoming so infected that she calls me one morning and she says, "Kim, oh my God, you got to see this video." And I was like, what's going on? And so I'm waiting for this video to come through, and maggots. Maggots had infiltrated her wrapping and had infested her toe. Now, granted, and I'm curious what even Ann thinks, and I don't want to get into a whole conversation about maggots, but I'm going to tell you, I've had to work behind the system to help another patient actually get a prescription for maggots. And then we facilitated through the Global P.A.D. Association, ordering those maggots, paying for them, and getting them shipped to the patient, and bringing in an experienced home care nurse to be able to administer them and remove them. And it was squeaky clean. So when this patient went to the hospital, this one just recently went to the hospital, and the maggots were in there. They left them in, thankfully. And I said, you need to ask them, if you're planning to leave them in now, and that which proves that you think that they were, why don't you prescribe them for patients? And the doctors just leaned over and whispered, and she shows me, this is what he did. She said, he's like, money. I was like, well, that's not okay. So anyway, so many questions about wound care here. You're laughing. Have you ever had a patient that's had maggots like that?
Yeah. In fact, we took down this was a few years ago. We took down a dressing from somebody's wound that kind of was coming to the cath lab for me to do a procedure on, and opened it up, and maggots were everywhere falling out. And obviously the first reaction is gross, disgusting, but clearly they're cleaning out the wound. The more concerning thing was, because it's a larvae, so there's a fly. I was thinking, gosh, how did they get into this person's hospital bed and then manifest that way?
Okay, that my question too. I don't understand. Where do they come from? Do they literally just come out of thin air? I mean, it's
a fly
amazing
that lays an egg, and then the egg is so that's the thing. So I was like, gosh,
so quickly.
Do we need to kind of like shore up the cleanliness here or what? But it was but the problem was the gentleman's leg was the tendons were showing, and it was non-salvageable. So you look at the wound and you think there's nothing we can do here, and he ended up needing a BKA. I didn't even do the procedure because there was no point, and that's another frustrating thing.
But it's just that it gets to that state, and then to think that still nature's creatures, nature, what was put on this planet, actually does a better job than a lot of the artificial stuff. I mean, we could get into fish skin and all this other stuff and why it's not being used. The natural stuff. Oh my goodness, my favorite from, remember, Nurse Practitioner Kay? She was heck bent on, you need to use Manuka honey, Manuka honey, Manuka honey, Manuka honey. Why do people betadine everything? Why don't you just use Manuka honey? And
We're
I can hear
more about Manuka honey and its properties here on the Heart of Innovation here on 1220 AM KDLW. Don't you go anywhere, guys. Let's have this great conversation and keep going on.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Dr. John Phillips' spectacular vascular moment of inspiration.
You know, Kim, like if ever I'm in a bad mood and I just hear that, it makes me laugh because it's silly.
every single time.
How do you not laugh? Like, how long have we been doing this for
laugh.
2 years, and it's just silliness. Anyway,
It's the best.
so my moment of inspiration, I have two words. And so lately I've been reading Meditations by Marcus Aurelius. So he's a Stoic philosopher. back, way in the day of the Caesar at one point. But so there are, like, stoicism is kind of this notion of the world is unpredictable. It's brief. You have to have strong, mental fortitude, control yourself, and kind of don't let other outside influences really affect you. And so they have 7 tenets. One of their tenets is memento mori. So it basically means remember that you too must die, and we're all mortal. And that is a little grim, but I think the tenet behind that, at least the way I think about it, is live life for the day and don't postpone things. Balance the good and the bad, but really, they say if you put your finishing touches on your life each day, then you never run out of time. So I would encourage anyone listening today in this conversation to just really kind of focus on doing the best you can in this short period of time and making the world a better place. Having said that, I'm happy to
I
welcome
think
Miss
that was
Ann.
the perfect foray into our guest.
Exactly. So
Doing
we have,
exactly just that.
yeah. So Miss Ann Welsh, she is someone who's kind of trying to make the world a better place in wound care, which we were just lamenting about how it's just there's gaps in it. She founded Wound Care Pro. And welcome to the show. Thanks for joining us. Can't wait to hear what inspired you to develop this app, right?
Yes, thanks for having me. It's great to be here. And I like the story about the maggots because I've seen plenty of those over the years. And I watched a program one time. They said a fly could smell a wound, I don't know, like how many hundreds of miles away. I'm like, who studies this stuff or how do they know? But they get under the bandage, but the wound is cleaned up, so it's not so bad sometimes. But usually the summer months, and you just feel like the heebie-jeebies as the sweat's dripping down. And you're in somebody's home, and it's overwhelming for the patient, of course. But I guess it's like fruit flies; they just appear out of nowhere.
Yes, they do.
They seem to. It was
Yeah,
amazing. This patient said to me, she said, I don't understand when the wound was so tightly wrapped, how it was even possible, literally, for suddenly to wake up, unwrap, and then have a sea of them
it's
in there.
unbelievable.
Nature is amazing. I'm sorry, but if whether you're religious or not, maybe God was trying to heal. He's like, hey, I'm summoning all of you to help.
Exactly.
Send in the troops.
Send in the troops.
So
Yeah,
anyway,
no,
Anne,
yeah.
so I know we could sit here and talk about this forever. We're very casual on this show, but we want to get into, so probably part of it sounds like you're frustrated that you don't have these maggots available every day for you for every single patient. Probably some frustrations as to why, but might be one of the forays into that led to you, creating this app to show what options are available for
Right.
doctors and clinicians around the world to help create the consistency that we do not have. Is that right?
Absolutely. And when I finished nursing school back in 1995, when I got into home care, I had no knowledge of wound care, and I was blessed to have a mentor at the time. And I know a lot of other folks don't have that. And here I am, all these years later, 29 years or so, and I still see those gaps that the nursing programs, medical programs aren't getting the wound care. And I see when they rotate through our hospice and palliative care, it's all new to them, whether you're trying to heal a wound or palliate a wound. So as I do, webinars and I've published, I said, what's a way to get it in the hands of everybody that wants this information? So that's when I thought of the app. And it's a good way to constantly update it when new information comes through, and then somebody has it at their fingertips. So it's, a way to bridge the gap with a shortage of wound specialized clinicians and also palliative specialized clinicians. So that was the goal with that. And I'm glad to hear people like Victoria finding it useful, and I welcome feedback to make it even more useful. I put video demonstrations in there. I've got links to other sites to get more information, more in depth, lots of pictures of patients I've taken care of over the years so that people could see what this type of wound looks like, what are your treatment options, what supplies are available, and how to use them properly. Because I do see that a lot. I'll see somebody using an alginate, let's say, on a dry wound, not understanding that is for, to absorb heavy drainage. So just constant education, not to waste the supplies, and also to hopefully heal these
So,
wounds.
Anne, walk us through what a patient should anticipate or expect if they have developed a wound. Let's say they go see their primary care doctor. He or she notices that the patient has a wound and refers you to a wound center or a wound clinic. is that an outpatient visit, or is that like, hey, let's get somebody to come into your home, do home health? How does that work?
Yeah, I mean, there are multiple options, but I do home health, love being in the person's home. I feel like, you're part of the family and you can really work with them. Other times, if they don't have that availability, they may go to a wound center. But we always look at the whole patient, not the hole in the patient, when we're trying to figure out what caused this wound so that we could hopefully get to the bottom of it and, try to beef up nutrition and it's a whole team approach, multidisciplinary. So everything from the obviously vascular, if there's vascular issues, but also registered dietitian, a diabetes educator, the wound nurse, and try to get all the team involved to heal these patients. I see a lot.
What are the questions
Oh yeah.
that patients should ask to determine if they're with a wound care specialist that is on the cutting edge, that is using the most advanced tools, techniques, and philosophies, most importantly?
Yeah, I think it's important to explain what treatment you're recommending and why. And also, let's say if the patient has a pressure injury, if nobody's teaching them how to turn and reposition to get off that wound, no matter what you use, if we're not addressing what caused it to begin with. So I think just being, making sure you're demonstrating and also making sure the patient understands the rationale, and then to constantly reevaluate that wound to see does the treatment need to change as the wound itself changes.
Do you find that the more insight you give the patient, the more inquisitive they are and I guess introspective when it comes to like evaluating the wound and wanting it to get better? Because I've seen lots of patients that my first touch with them is they have this gaping hole in their foot. And it most often starts with like a little black dot or a tweaked toenail or something. And you think, how in God's name did it go from this to this with you not, as a patient, having alarm bells going off in your head?
Absolutely. And it's sad too if they go to a healthcare provider and nobody's looking at their feet, the person's at risk. So I think lots of education. And I think patients don't, if they see a callus on the bottom of their foot, like, oh, it's just a callus, not understanding it could be an ulcer underneath that, and it could lead to all these complications. I think it's just lack of, unfortunately, education on the providers end, that nobody's, they're not necessarily going to know this themselves if they're not educated.
And coming up right here on the Heart of Innovation, we're going to hear from a user of the app and why she feels it has changed the game for her care for her patients. So stay with us right here on the Heart of Innovation. Don't go away.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thank you for joining us on this wonderful Saturday. We're continuing our conversation with Ann Welsh, a wound care specialist who, on the side, has a side hustle, right? Developed Wound Care Pro, an app. So the app's for clinicians, right? So, like, walk us through why somebody would want to download it and then how they use it. And then that kind of dovetails into Victoria Davis. She's one of our guests as well, who's using the app, as I understand it. Correct?
Mm-hmm.
Yeah, so there's a shortage of wound specialized clinicians. So it's hard for if you're a generalist nurse, let's say, or a clinician in any setting, you might be like, what do I do for this wound? And the patient's coming to you. So here it is at your fingertips. Okay, it's a pressure injury stage 2. What does that look like? What are my treatment options? It's a diabetic foot ulcer. Who else should be consulted to, treat this wound, not just a topical treatment itself, but looking at the whole picture. So it's really there for clinicians to hopefully better serve their patients.
And what has been the reception
Oh, it's
for
been excellent. I got great feedback. I even had somebody the other day. She was out of the game for a while as a nurse, and now she's back in. And she called it her little pocket buddy that she carries around the app with her to wound care. And she's wound certified, but she's been sort of out of the game for a while. So this brought her back up to speed.
And it's an important point to make that continuing medical education. I always tell my patients, make sure that you do have someone who's certified in wound care, because it is an additional CME credit, right? It's an actual certification you can get. And I know a lot of vascular specialists. I think John was even mentioning this earlier, that there are a lot of vascular specialists who are now getting their wound care certification simply because there is a shortage, and they don't want to risk actually having their patients leave their table where they have just opened up the arteries, got fresh blood flow, and then not have consistent control over that patient and consistency in wound care through their own facility. And they said that, in doing that, that's actually improved their amputation rates. But having something like, this app could help democratize access to wound care for more people.
Absolutely. And I work for hospice. We see amazing healing going on in hospice. We may say,
Oh,
oh, they're
that's
never going to
amazing.
heal. And, if you do the right wound care and obviously treat the patient, try to get nutrition and whatever as tolerated, we see amazing outcomes.
See, that's awesome. I have a patient over in Europe, and I'm very frustrated with this situation where the patient there in England and some parts of Europe, I feel like patients are marked palliative a little bit sooner rather than later, which
Right.
decreases the access they have to limb-saving care in my experience. And so, for example, we had a patient that had cirrhosis of the liver, is ESRD, final stages of chronic kidney disease, end stage, and had a necrotic toe. And they decided that it was not, the patient could not go under anesthetic because of the comorbidities. But they decided not to use even a local to just try and open up some of the wounds. And they didn't even provide advanced wound care because, well, the patient's palliative, they're going to die anyway. Our team decided the best option was literally just to put them under hospice and let them go. And I was like, that's just, to me, unconscionable, because as you're doing, and this brings hope, at least for people here in the US, and I hope it would inspire folks in other countries, that it's the right thing to do to provide this special wound care and not let these poor patients in hospice become necrotic and literally watch the infection and gangrene grow and crawl up their leg.
Yeah,
Can you
absolutely.
even imagine?
I actually went to a conference in London about a month or so ago to present my poster on wound care in the hospice setting and showing
That's
these
good to
healing.
know.
Yeah, I mean, sometimes, of course, healing may not be possible if there's no blood flow or end-stage cancer, something along those lines, but amazing outcomes of healing that does occur. So we always remain hopeful.
Can
And
we
how are you
bring
getting the word out?
Well,
That's what I was going to ask. Yeah. How
yeah,
do
I
you
guess
get the
just
word out? How do
social
you
media,
just conferences? Okay.
Yeah.
So
Because
speaking of getting the
obviously,
word out, right? We
exactly.
have Miss
Good
Victoria
transition.
Bateman. Hey, you know
Yes.
what? I'm learning. I'm not as good as you are with going like to break, but I'm getting there. But so,
Yeah.
Victoria, welcome to the show. You are someone who's using the app in real time. Is that right?
Yeah, so I am currently working as a wound care nurse. I've been doing it for a little over a year, and I just graduated from Emory's program, and I was a full scope student. So I'll be getting certified in wound care, ostomy care, and continence. I came across the app as a PRN hospice nurse. I also
Wow.
have a background in home health and hospice, so familiar with patient homes, and we do a lot of wound care in those settings. And I was have my coworkers knew that I was going to school, and so they'd say, "Victoria, what should we do for this wound? What should we do for this wound?" Um, and I was getting a lot of those questions, and sometimes, I can't recommend what to do if I'm not there looking at what supplies they have and what, do they have a offloading surface, like what's causing the wound. So I kept saying, hey, there's this app, it's not very expensive, did you buy it yet? And I just keep recommending it. LinkedIn is a place where I kind of bookmark things that I find, so that when I'm in a patient's room, or we have new hires that they might be experienced nurses, but they don't have the wound care experience like we were talking about earlier. It's definitely something that's taught on the job. And this is just, it's like having a textbook in your pocket. Kind of, Anne mentioned that earlier. It's like a little pocket buddy, and the pictures are really helpful for education for patients. And I did want to mention also, she has all of the ostomy care on there as well. So what I'm noticing is a lot of bedside nurses aren't familiar with ostomy care because they just don't do it as frequently. And so it's just a great resource. You can look at what your formulary is. My formulary for hospice is going to be different than what I have inpatient. And I can look at the categories of products and see what's appropriate to treat the wound. And I just keep recommending it over and over and over. And that led to Kim seeing it, because I'm connected with her on LinkedIn. So it's kind of neat how LinkedIn brought all that network together. And thank you for the app. And it's so useful. I recommend it all the time.
Thank you very much. I noticed the same issue with ostomy care, so that's why I added that on.
Can I ask both of you, so there's a shortage of individuals going into wound care, why do you guys, correct me if I'm wrong, but if there is, which sounds like there is because that's why you did the app, why do you guys think that is?
Yeah, it's hard to say. For some reason, it's just not a part of the nursing programs and medical programs. And then when people are out there, they realize, oops, I don't really know, and I don't know if there's not enough people going into wound care. I had a mentor and she, got me so excited about it that I went to Emory also all those years back. So I'm not sure why.
But so does it, like, if you do into wound care, are you pigeonholed to like home health? And if maybe people don't want to go into other people's homes, or, I mean, we have wound care folks in our hospital system.
Right.
I know that, but I guess I don't know enough about it in the outpatient setting.
Well, I love home care, but you could be in any setting as you want to. So home care was good for me. And what the nurses will take a picture of the wound, email it to myself or my colleague. We'll look at and give recommendations, and then they have the app for education purposes and after hours when I'm off and weekends.
I do want to mention ostomy. It's the surgical opening, right? It's just any opening from surgery, right? That you're caring for the wounds from surgery. I just
Yeah,
want
and
to
the person
clarify.
has
I was getting
ostomy
the question.
themselves for elimination if they have, let's say, ileostomy. A lot of nurses don't know how to order supplies for that or how to educate the patient on dietary or how to protect the skin around, even if the actual wound is healed. So it's just like, I find that that's a problem, like Victoria said.
Do you also offer in the app the diet? Because I know that the diet is so important. Even Abbott, who has been one of the supporters of our show in the past, has they have a drink, and I think it's called Jervy, that is a special formulated drink for wound healing.
Yeah, I do mention nutrition in a section of it under pressure injuries, and I refer them back to that section. And they talk a lot about nutrition and different supplements available. That's one of them, like Juven and different ones that are there that have all the, essentials to heal a wound.
Do you talk about the importance of having the conversation with your patient about smoking cessation, because the oxygen can't hop on the
Yeah.
school bus if the nicotine's on there? So no oxygen's being delivered to the wound as long as you have nicotine in your body, right?
Absolutely. We talk to them about options to try to stop smoking if they're open to it, and constantly, revisit that in each visit.
Well, coming up right here on the Heart of Innovation, we'll have more with Ann Walsh talking about her new app, Wound Care Pro. So stay with us right here on 1220 AM, The Answer in the San Francisco Bay Area, streaming online across our YouTube channel, youtube.com/The Way to My Heart. Make sure you like, subscribe, and visit our YouTube channel to get more amazing content and to hear and view past shows.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thanks for joining us. Let's continue the conversation about wound care and newer technologies out there. So let me ask you this, Ann. The app itself, I mean, aside from kind of describing types of different wounds and having clinical literature about them, is there AI that's involved with this at all? Or, I mean, everyone's talking about AI, but if it's not involved already, do you foresee using it in the future to help clinicians such as Victoria out there who are maybe on an island kind of work through some of the algorithms of treating patients who have various wounds?
Yeah, it doesn't have AI now, but definitely could foresee that being and taking it to the next level for sure. I'd like to have more video demonstrations in there because I think we all learn by seeing a lot of times, and we tell a patient, "Oh, turn and position the person with pillows," and we walk out the door and they don't know what we're talking about. I shared a story years ago that I came to see the patient and I said to the daughter, "Where's mom?" And she's pointing, she's over there. She was literally buried in pillows. She said, "They said she needed pillows." I mean, it's extreme, but we need to demonstrate to them. And actually, National Pressure Injury Advisory Panel has a nice video showing how to turn the person. So I have that in the app too. So it's like 3 seconds that somebody could tap on it, show the family how they're supposed to reposition the individual in bed.
You bring up such a good point right now in terms of bed sores or the pressure wounds. I can't tell you how many patients that they're in the hospital for even just a few days, and they end up they go in. We had one patient here in the San Francisco Bay Area in a large HMO hospital here, and the doctor was trying to convince her to have this axillary bifemoral bypass, And we were trying to say, whoa, second opinion, just, go in a minimally invasive way and suck out that clot in her aorta. So the doctor just left her there for 4 days until she would, come to the right frame of mind and agree with him. And she developed a bed sore on her, I'm just using layman's terms, butt crack. And
Yeah.
it got, well, so while we finally were able to get her a second opinion and the other doctor went in, opened up the artery, it was beautiful, just sucked out that clot. She literally had to keep going back for weeks and weeks and weeks to have this pressure sore, this wound. It just would not heal. Because the location, but poor wound care as well. I mean, prevention is so key. And is that something that you try to address in the app too, to educate people on prevention?
Absolutely. Anyone that's at risk, of course, if you're in the hospital, automatically you're at risk because something's wrong that you're in there. Most likely you're
Yeah.
not eating enough, and then if you're immobile or whatever, then you need to get a support surface on that bed and turn in position and try to maximize nutrition, diabetes control, all that.
Yeah, there are certain types of beds that I think that you can get if you're at risk for pressure sores. I think that you can actually request. Is that correct?
Yeah, there's certain mattresses that could be put on the bed depending on what, there's a group 1 product, which is an overlay, would go over the hospital bed mattress. In the home we use oftentimes for prevention. And then you step it up to a low air loss mattress if the person develops more extensive wounds.
I'm curious, just from your standpoint, there's so many people, and even, Dr. Phillips can probably jump in here on this. I mean, I'm sure there's so many times where a clinician or physician has ideas and you see these gaps in care. What was the catalyst for you to go from, I'm going to stop complaining about this, and I'm just going to do something about it? And what are the steps you took to actually make this happen? Because I even know myself, I'm more of a creative, and I've been trying to develop apps, and it is not easy to communicate my ideas to a developer. And I see John nodding over there.
Yeah, I actually, probably about 7 years ago, we developed, or I had the idea. It was frustrating, right? Because you're seeing people that have this wound, and it's like, why didn't you take a picture of this and send it to somebody? So then we developed something called Wound Watch, or I called it Wound Watch. And then we changed it to something called Shutter Health, which was ultimately, taken over by another company. It really honestly didn't go anywhere because it was like, so our electronic medical record that we use, Epic, but there's other ones out there. It allows folks to take pictures of things, but you want to raise awareness. You have this idea. It takes a lot of money to develop an app, at least in my experience. And it's kind of, I think, hard to disseminate the information. It sounds like it's a lot easier now with LinkedIn. And then obviously if the app works well, like Ann's app does, people will latch on to it, and then that'll help it grow. But it is not a small undertaking. And Ann, you know that as well, because there's a lot of stuff out there. And plus one of the issues that we have is integrating it with our electronic medical record. And some of them are pretty closed to third-party vendors. So that's a roadblock as well, at least in my opinion.
Yeah, it's definitely hard. I started going to conferences or doing webinars. I guess after COVID, we were more at the computer. So it was a way to access people to educate about the app. And then sometimes certain things you're not allowed to say the app, but you can put it as a resource in there, because they don't want to be commercial based or whatever. But I think that was a way to get it out there. So I've spoken with the Hospice and Palliative Nursing Association, very popular one because folks in hospice want to learn more about wound care and ostomy care. And like social media, like I said.
What about this is very frequent, and I'm not trying to say that there's a black eye on nursing homes and extended care facilities, but it's not uncommon for us to see a patient whose family member went to see them. They've been in a SNF or an ECF or something. All of a sudden they look, the daughter looks at the foot and like, what's going on here? How did this happen? That's really frustrating for obviously the family, the patient, and then us as those proceduralists who are seeing it at the kind of the reactive side of things. Do you think that there's a role for this to be proactive at some of these facilities where you can get in the hands of maybe a medical assistant or somebody who just says, this doesn't look right, help me? kind of deal.
Oh, definitely. I mean, I guess in the facilities to have it on a webinar, I mean, on like a computer base would probably be easier than the home. We're carrying our phones around. In the hospital, I don't know, does everyone have their phone in the back pocket? But so to be able to create that, I think would make it more accessible. But certainly they could, educate themselves so they know next time they see a wound like this, what can they do, and educate their staff, especially prevention. Like you said, sometimes it's so simple to get the heel off the surface and not let the person after they get hip surgery and now they got this horrible heel wound that won't heal. And then progresses and they come out, the hip surgery is fine, and now they got this horrible wound on their heel.
I can
Simply
see
not putting a pillow there to lift it off the surface.
I can see Victoria nodding back there. Victoria, is there any one story that stands out where you were able to pull out this and it saved the day with one of your patients? Go ahead and unmute.
What I was actually thinking as Anne was talking was just that so when I was working hospice and home health, I did go to a lot of facilities like we were talking about, whether it was assisted living or skilled. And sometimes they have protocols that are outdated for skin tears, is what's coming to mind especially. And the one that I'm thinking of, the protocol was that they just cover it with Tegaderm, which is not the best treatment for a new skin tear. And so one thing I think would be helpful for those clinicians, because really we want to do the best thing for our patients. Like all the nurses I've ever worked with, that's what we want. We're patient advocates. We want to do the best thing for them. And so I feel like if you have an app like this, it's being updated, it's up to date, and you could bring it to your employer, your medical director, whoever makes the protocols, and be like, hey, we do this. And actually what they've found is better for the patient is if we do this. And then Anne has like the research articles behind it, like linked right there. So it could be a way to change policies, that, as a clinician, you could actually impact an organization.
Wow, that's brilliant. That's a lot of work, Anne. You not only have the information, but then you're putting the evidence behind it. That's incredible. Well, coming up right here on the Heart of Innovation, we'll have final thoughts from Anne. So stay with us right here on 1220 AM, The Answer.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Well, everyone, welcome back to the show. And we have Anne Walsh, the founder of Wound Care Pro, who's with us. John, this has been a great conversation.
It has. And I think the beauty of this show is it's innovation, right? And we're trying to democratize and I don't think weaponize is the right term, but use technology to help people. So, and on that note, what are the next steps? Like, what would you like to see this app develop into maybe in 2 or 3 years? So I look at it and like, is there a way to use the camera on the phone to show maybe the depth of the wound, or I don't, something along those lines? I mean, tell us where you want this app to be in 3 years.
Yeah, there are apps on the market now that do measure. They don't tell you what to do with the wound, but they will. You take a picture, it'll do the length, the width, and some of them will do the depth as well. You still have to get that Q-tip out and probe the edges to see if there's any undermining or tunneling, but at least they'll give you that, and then you put that in the chart and you could track. So I would like to see this do some of that. It would be great because you'd have all in one spot rather than have an app to do the pictures and an app to measure, and then another app to educate. So, and hopefully with AI or something along those lines would bring it to the next level. And like I said, more video demonstrations, I think. Even somebody was asking me about the VAC, the vacuum assisted closure or negative pressure wound therapy, if I had an app to show them how to use that. But I told them, sure, it's already on YouTube. But even those kinds of things to have the nurses out there by herself himself in the homes, that you're not in a hospital setting. You could say, hey, can you come in and help me or show me that you're out there? So this would be something you could look at before you go and see the patient to brush up on the procedure.
And for the clinicians,
for
the clinicians that are listening, I saw in the App Store it's $4.99. I'm assuming you have to cover the cost. Or you're not using this to pay for a house in Tahiti or anything, are you?
Yeah, yeah, it covers the cost. It's a $4.99 one-time fee, but yeah, there's cost with the security of the app and everything every year. and all these other fees. Every time they reach out to me, there's, you know, another fee, but that's
There's
all right.
always another fee, developer fee, updating
Yep.
fee,
Exactly.
services,
I just said it the other
storage.
day, Android is going to be updated to 14. It was another cost. So it's okay.
It does. It's just constant. So it's really important to be able to go in and support an amazing clinician entrepreneur such as Anne.
100%.
I'm curious from Victoria's perspective, anything that you'd like to see going forward with the app and integrations. I could see this being a great integration into the app CarePix. I could also see it integrating into some of those. And I do believe in like not reinventing the wheel. So I'm hoping that people will align with you and say, hey, we're going to go to Anne for the most updated education, and we're going to integrate her education into what we're doing versus reinventing the education wheel. Partnerships are always, I think, key.
Absolutely.
And Victoria, what do you think?
Yeah, I'm excited about the idea of some videos that are accessible. And you know, so as nurses, everybody specializes, and we don't do the same procedures over and over and over. So even something simple like packing a wound, a bedside nurse or a home health nurse, they might not have done that for a while. And like I said, we want to do the best thing. We want to do evidence-based treatment, and we want to do it right. And so I just feel like a video addition to the app would be amazing. I'm already going to recommend it, but yeah, that's great. That's a great way to go. Measuring would be helpful. That would be nice. It's one less thing, you know, save a little time. And it's not subjective, right? If you have a computer doing it, then it's not subjective in that way. It's a little bit more indicative of if the wound's contracting or not.
Can you upload this information into the patient's medical chart, or is it housed in a separate, like, is that a separate
Not
area?
through this app.
Not through this app. No, it's separate. The apps that some people use to take a picture of the wound and you know, gets the measurements and all that, those you can update and, you know, upload to the whatever, you know, if you're using Epic or any of those, depending on which one they
Gotcha.
work with. Like home care.
For
home care.
those who want to download this, and I have a feeling because a lot of our audience, we have a lot of patients that are watching, I'm sure they're going to want to download it and show it to their own clinicians, physicians. It's all about diaspora and creating this groundswell, right? And getting this app out there and improving the education to improve wound care and reduce those amputations. If you want more information on this app, just you can Google Wound Care Pro. You can also go to the App Store, Google Play, and download it as well from there. Have a great weekend, everyone.
Thanks, everyone.
Better quality of life through
Thanks, everybody.
comprehensive education, real-time support, and